In daily life, we often believe that eating a lot of green vegetables, it is good for health, helps detoxify the body, and supplements vitamins and fiber. This is true, but not enough. There are some vegetables that seem harmless and nutritious, but if eaten incorrectly or in excess, they can silently damage your kidneys. The following story will surprise many people and help you better understand why proper preparation is so important. A warning story from a kidney transplant patient, Mr. Tran, a man in China, underwent a kidney transplant 2 years ago due to end-stage kidney failure. After the surgery, his health stabilized and all test indicators were within normal limits. Since then, he has paid special attention to his diet, avoiding alcohol, limiting salt, and eating plenty of vegetables and fruits to keep his body healthy. However, during a recent follow-up, doctors found that his blood creatinine levels had risen abnormally. This is an important sign indicating that his kidney function was having problems. Upon further examination, doctors found that his kidney tubules were blocked by calcium oxalate crystals. When asked about his recent diet, Mr. Tran recalled that it was amaranth harvest season, so he had been eating this vegetable almost every day for a whole week. The doctor immediately confirmed the main cause was amaranth. This vegetable contains a high amount of oxalate, and eating it continuously in large amounts can easily form crystals, causing urinary tract blockage and seriously affecting kidney function. This is a warning not only for kidney transplant patients, but also for anyone with healthy kidneys. 10 types of oxalate-rich vegetables that can harm the kidneys. Not only amaranth, many other vegetables commonly eaten also contain high oxalate levels, which if eaten improperly, increase the risk of kidney stones. Here are 10 typical vegetables. 1. Amaranth, rich in iron and vitamins, but contains a lot of oxalate. Eating a lot can cause crystallization in the kidneys. 2. Spinach, considered a superfood but is a natural storehouse of oxalate. 3. Purslane, a common cooling vegetable, but with quite high oxalate content. 4. Fresh bamboo shoots. Many people like to eat bamboo shoots, but eating too many fresh ones can increase oxalate and cause stones. 5. Chives, warm in nature and good for digestion, but also high in oxalate. 6. Celery, helps diuresis and clears heat, but can increase oxalate if eaten continuously. 7. Water spinach, a familiar summer dish, but also contains a significant amount of oxalate. 8. Bamboo shoots, not only contain oxalate, but also natural toxins. If not prepared well, they can be harmful. 9. Lotus root stems, cooling and blood nourishing, but high in oxalate. 10. Bitter melon. Although it lowers blood sugar and cools the liver, it also has a high oxalate level and can affect the kidneys if eaten excessively. Why is oxalate dangerous? Oxalate is an organic acid found in many vegetables and fruits. When entering the body, oxalate easily combines with calcium to form calcium oxalate crystals. This is the main component in over 80% of kidney stone cases. If oxalate accumulates for a long time, it can block kidney tubules, reducing the filtering and detoxifying function of the kidneys. Even healthy people who eat too many oxalate-rich vegetables can face this risk, not just those with a history of kidney disease. How to eat vegetables without harming the kidneys? Doctors recommend a very simple but extremely important step before cooking vegetables: blanching them in boiling water. The reason is that oxalate dissolves easily in water, and blanching removes most of the oxalate. Spinach, just blanch for about 1 minute. Purslane, should be blanched for at least 3 minutes. Amaranth, bitter melon, blanch for 2 to 3 minutes for safety. After blanching, discard the boiling water and continue cooking by stir-frying, making soup, etc. This significantly reduces the remaining oxalate in the vegetables. Some important rules when eating oxalate-rich vegetables. Besides blanching, you should also note: do not eat too much in a short time. Balance your menu and alternate different vegetables. Drink enough water daily. 1.5 to 1.7 liters, helps eliminate oxalate through urine. Eat with calcium-rich foods, such as milk, cheese, small fish, eaten with bones, shrimp, tofu. When calcium binds with oxalate in the intestines, they are excreted through feces instead of accumulating in the kidneys. Choose ripe fruits, because many green fruits like mango, plum, peach, pineapple have higher oxalate levels when unripe. Green vegetables are an indispensable part of a healthy diet. However, you need to understand that not all vegetables are better the more you eat. Amaranth, purslane, spinach, or bitter melon can all become hidden enemies, silently harming your kidneys if not prepared properly. Just a simple step of blanching vegetables before cooking, along with drinking enough water and balanced eating, can help protect your kidneys and keep them healthy. Remember, health comes from small daily habits. And if you find this video useful, don't forget to follow the Everyday Life channel to update more useful knowledge to help take care of yourself and your family smartly and safely. Thank you for watching the entire video. Wishing you success and good health always.